You are listening to Oh My Health, There Is Hope podcast.
When your heart is aching and your world is shaking, don't give up. No, don't give up.
Hello and welcome to Oh My Health, There Is Hope, the podcast. I'm your host, Jana, and today I'm here with a really special guest, Dr. Stephanie Canestraro. Dr. Canestraro's journey to the top functional medicine and specializing in the vagus nerve started with a painful personal history that ultimately gave her the determination to innovate her field and help others. Persevering through the agony of her health issues, Dr. Canestraro applied what she learned from the top functional medicine professionals to her own symptoms and finally overcame her condition. Whether she's helping an athlete deal with pressure, recommending nutrients and supplement regimen, or applying one of the numerous treatments methods she's educated in, Dr. Canestraro is pioneering overlooked field of functional medicine while helping the world's top sports stars optimizing their aspects of their bodies. Wow. The vagus nerve is a big thing for me because mine was damaged and my life changed and I didn't realize how powerful it was. So welcome to the show.
Thank you. Thanks so much. And thanks for that intro or reading that bio.
I love it. We're putting all of that, by the way, her bio, her links, everything amazing to connect with her and learn more about your vagus nerve. We're going to put all of that in the show notes. But the very first thing we ask everyone to do is share their story of hope. I can tell that you have a powerful story because you touch on it a little teeny bit in your bio, but I would love it if you could share your story of hope with us.
Yeah, of course. So, in my early 20s, and I'd say even as a child, I was, that one that was always sick. There was always some weird symptom popping up. And I was in chiropractic college and it kind of all came crashing down. And I got fairly sick and I was in and out of seeing specialists and not getting the answers that I knew that there were answers to what was going on. And a lot of my stuff was neurological symptoms. So, I had a tentative diagnosis of multiple sclerosis. And what I realized down the road was, they give these names for diagnoses and scare you with these things, but there's always like an underlying root cause. So that was my story of hope. I found Dr. Terry Walls, who was in a tilt recline wheelchair with progressed MS and healed herself. And so she was an MD and she found that drugs weren't working. She went to the Mayo Clinic, Cleveland Clinic. She did all of this, all of the new cutting edge things. And like what it came down to was more of the basics. Okay, diet. She was a vegan, she needed protein, she needed certain nutrients. And so I followed her little protocol and I slowly got better. I saw improvements. And then that catapulted me into the field of functional medicine. And I was already in chiropractic college, as I mentioned. And I thought, how am I going to treat these people? How will I be able to have a practice when I'm feeling so sick? Right. And so it empowered me to be able to fix myself and then become really successful, able to see numerous people a day, and then eventually help them also with functional medicine or just root cause medicine, helping people get to the bottom of what's going on. And if you've ever been sick, then that type of hope might be the most powerful, right? That the power is within you with these things that you can do. It doesn't have to be so dark and dreary and, gloom and doom. So that for me, taking the power back and now being able to empower other people is, I think, gives people hope and helps them heal ultimately and helps your vagus nerve, right? Which we'll get into.
So I want to get into that because I didn't even know what a vagus nerve was until mine was damaged during a surgery. I had a fundoplication done. It was the second one. And because of the scarring, they damaged my vagus nerve, which meant for me, my life completely changed. But I didn't know what I even had a vagus nerve, what that was, what its job was. Why don't you tell us a little bit about what the vagus nerve is and how it works in our body?
Yeah. So the vagus nerve it's our 10th cranial nerve. So we have 12 cranial nerves. That means they come off like our brain or our brainstem. And it's the 10th nerve. It's called the vagus nerve because from the word vaga, which means wanderer, because it is the longest cranial nerve and it innervates almost every organ. And it's in charge of our rest and digest, or parasympathetic, if you've heard that word, which is the opposite to sympathetic nervous system, which is when we're in fight or flight, which, in this day and age, people are ultimately in fight or flight a lot, especially with fear. Fear puts you into fight or flight. Humans can use their thoughts and put themselves into fight or flight. And we're not being put into our rest and digest, our parasympathetic, our healing side of our immune system enough, and we become more inflamed. And, so it controls your, like I said, immune system, inflammation. Like they've implanted devices on the vagus nerve for people who are really sick, and they're being able to stimulate it in the neck because it starts from your cranial, the base of your brainstem. And there's 2 branches, and it comes out and exits and goes down your neck, under your clavicle, and innervates down to all your organs, all the way down to your large intestine, right above your colon is where it stops. And so it's always taking information from your gut of what's going on there and bringing it up to the brain. It's, an unhealthy gut affects your brain because of the vagus nerve. Like they've now found that bugs and different toxins can travel up the vagus nerve into your brain. So you have to have a healthy gut to have a healthy vagus nerve. You have to, but then you can also not that I'm saying to stimulate your vagus nerve. This is just to show how powerful your vagus nerve is. When they put these stims on people and they were able to use a button to vibrate the actual vagus nerve to kickstart it, people were going into remission of these long-standing inflammatory autoimmune diseases, stopping seizures, all of this. And because even when you stimulate the vagus nerve, you can influence the gut, and then your gut microbiome can become more healthy. So, we can change our microbiome with what we eat, and that's all the bugs in our gut, or, supplements with, eradicating bad things in your gut, or we can utilize a lot of simple exercises for your vagus nerve to help strengthen that side as well, get you out of fight or flight, help your body heal. So, it's just in charge of that healing side of your nervous system.
So is that what they refer to when they call it the gut-brain connection? Like the vagus nerve is literally connecting our gut and our system to the brain.
Yeah. So that's the structural connection. And then it's connected in a few other ways through chemokines, which are just little transmitters that speak back and forth to our brain, and immune cells, but that is the direct connection. So that would be, I'd say, the most important connection if you had to, and there's ways to train your vagus nerve using because it innervates your heart as well. So heart rate variability. I don't know if you've ever heard of that. You probably have, but if the listeners have, it's the interval between beats, and it's not, your heart's not supposed to be beating the exact same each beat. There's supposed to be different times in between. That's when you're healthier. That's when your parasympathetic nervous system is turned on. So you can actually practice that with little feedback things that you plug into your phone. Even the Apple Watch now has ways to monitor heart rate variability. And the more coherent you are, which means the more variable beats you have, then, the better you'll heal, the less chance you are to catch a sickness, right? So you can use it as biofeedback in a way to train using thoughts, using your breath. And you can actually, that's one of the very powerful and proven ways to kind of train your vagus nerve. There's even external little devices that you can put on the tragus of your ear, the little part on your ear. And you clip this thing on and you can send stimulation, and that's another way. And then there's simple exercises that we teach people as well. Acupuncture, different smells, essential oils. There's a plethora of things like gargling, gagging, all of these things that you can do to help your vagus nerve.
I love that there's still hope for people out there struggling with vagus nerve issues, but I'm telling you, I bet a lot of you are struggling with it and don't even know. You haven't put it together, which is what I want to talk about next. What it means being a functional medicine doctor and what the root cause means. Those are I'm hearing functional medicine all the time, and I'm hearing root cause all the time. And I don't think people really understand that when you go to the doctors with a symptom, they run a lab work, right? Which is a picture of time, that moment. And they'll be well, your labs look good, but you're suffering from headaches. So here's a pill. And of course, then the headache goes away because we're taking the pill. And yet that root cause that caused the headache is still festering in there and can grow into something even bigger if it's not addressed. So when I go to my regular doctor, I spend 15 minutes. I could push it to 20, but it's difficult. But when I go see my functional medicine doctor, I could be in there for an hour and they're asking me things like, did you have earaches when you were a child? And what kind of a diet were you on as a kid? And like, they're pulling my whole history basically together to start piecing things together on what is causing this. And so I just think that if you could explain a little bit about what getting to that root cause means for someone, how that, because they're like, well, I don't have a headache anymore because I'm taking a pill. So that's good, but it's not.
No, I mean, here's like a kind of ambiguous example because it was one of the things that happened to me. And I didn't understand until years later, like what was causing this one very strange symptom to me. And it was that I shocked everything, like electricity. Like anytime I touched something, I shocked it. I went to hug someone, I shocked them, you know, when you, and that was happening all the time, like so much static electricity. Right. And so, you know, at that time, I didn't know what was going on. I was really sick. That was back in the day. And now that's part of one of our questionnaires for either Lyme disease or mold, because Lyme disease, which is a root cause, like one of these stealth infections. So Lyme disease is, you know, a lot of people know of it from getting a tick bite, right? So you get a tick bites you and then you get, some bacteria from them and they can cause like a low grade kind of stealth infection. Some people it's more obvious, but there's certain infections or certain things like mold that change your whole, we're vibrational beings, right? It changes the whole vibration. It changes our electrolyte balance and we end up having static electricity. Like that doesn't make sense. And we're shocking everything all the time. So that's kind of a funny one because like, who would think that? But I just remember once I got into functional medicine and I'm reading some of the questionnaires, I'm like, oh, I didn't know that symptom was associated with that underlying infection. And, you know, other root causes, like even of a headache, like poor drainage, like your liver's not draining properly, like your bile's sluggish, like, you know, those type of things, like clearing toxins, like we get exposed to so many different toxins, so many different bugs, viruses, all of this stuff all the time. We're inundated with it these days. They've invented way more chemicals way too fast for like our body to kind of adapt to it. So, you know, it's part of it. It's removing something from the body that's causing our body to give us a symptom. So that's what we do. And we're peeling back layers. Like I use that. I'm always like, we're peeling back layers. Like this is the top layer we can go after. And then something else comes up. And that to me is functional medicine or root cause medicine. Like for me, I didn't know I had parasites, Lyme and mold, like, and those were the key things that were making me have neurological problems. And they hijacked my vagus nerve and I was in perpetual fight or flight. And then I became the person, if I bumped my head a slight little bit, I had a full-blown concussion. And that's how I kind of started tying together. My gut started getting healthier. I killed off the parasites. I killed off the Lyme. I got rid of toxins. I helped my liver drain better. And my head became stronger. Like I could, you know, my nephew accidentally hit my head and I was like, oh no, I'm going to have like a concussion symptoms. And I was healthy and fine, you know? So it's just like, that's what we kind of mean by getting to the root.
I love it. Dr. Canestraro, for people who are not familiar with that, what are some symptoms that your vagus nerve may need some attention and it's causing some of these things? So what are some things that maybe people aren't recognizing? My biggest thing for me to know there was something wrong with my vagus nerve is my stomach. I got gastroparesis, which I didn't know at the time, but it would not empty. And I started looking pregnant and people would walk up and say, congratulations on the new baby. And I'd be like, first of all, thank you, because I'm in my 50s. Having said that, I'm not pregnant.
Yeah.
Yeah.
So, well, there you go. Gastroparesis is one of them because it's in charge of like the downward movement of our bowels called peristalsis. So if that's not moving downwards, then we get bloated because stuff sits there and then we can get overgrowth. That's one of the signs of vagal nerve dysfunction. Other things are like heart arrhythmias, like when people start getting high heart rates or different flutters in their heart. There's changes in your voice because it's part of the laryngeal. It innervates like our voice box essentially. So Inability to swallow pills is one where people can't swallow pills. And then like the list goes on, like SIBO, parasites, like all that, because if you don't have that downward movement, then, and then also being in that, what I said before, feeling like you're in fight or flight. So anxiety, intrusive thoughts, the list goes on, like nausea. There's just so many different, and also even getting sick often, like those kind of things. Like you have to check out and see if your vagus nerve is part of the problem. It probably is.
So in the US, by the way, I don't know how it is in Canada, but in the US, let me tell you a little bit how uneducated doctors are on the vagus nerve. So when my vagus nerve first, they found out I had gastroparesis, they sent me to a specialist out at Cedars-Sinai, which is a big hospital here, and then UCLA. And to this day, until you just started talking, I was like, wait, it's my vagus nerve. So I've been having these massive heart palpitations. I feel great, but I'm in my 60s. And when your heart's not feeling right, you're like, what's happening?
It's
like,
scary.
why is that? They've sent me to cardiologists. Everything looks fine. It is. I just realized now it's probably my vagus nerve causing it.
Yeah. Yeah. And I mean, other things like toxins, overloaded toxins, like your heart's going to want to pump faster if you've had a toxic exposure, but vagus nerve is a very common cause. And a lot of people, orthostatic hypotension, like when people stand up and they dizzy and they feel like they're going to faint, or like POTS, like when their heart beats too fast, like they are now starting to name that as like a vagal dysfunction, like in like allopathic medicine. And I'm having a lot of people then like find my clinic and then, because they're starting to like throw it out there, but they don't really know what to do with it yet. So, I'm starting to see a change, but like I said, they can name it, but they don't really quite know how to help someone with it.
So one of the things you said about peeling back the layers, I want everyone to understand, we say this on the show all the time. There's no such thing as, there's no destination called the perfect healthy place where everything's perfect.
Mm-mm.
And so it's a journey, like it's a journey to constantly be doing better for yourself, to work on one more thing. And I know that your healing process wasn't the flip of a switch. It was one thing at a time, starting to recognize that this isn't good for my body and removing it. This doesn't make me feel good and removing it. So I don't want anyone to feel like overwhelmed, like, oh my gosh, there's so much. This for me was an 11-year journey to be here and do the things I'm doing now. And I just learned something new. So I think that it's pretty amazing when you are talking about the things that we're discovering and maybe we can name it, but we don't know what to do about it yet. We will, at some point we will, because now we recognize that it's an issue. So I love that you're on the cutting edge of all of that. What would you tell people, like, what is the one thing that they could do maybe to give better health to their vagus nerve?
Well, they can pick between their favorite, like different ones work better for others. Like, I mean, box breathing, like that's a simple one where you take a deep breath in, say it's 4 to 5 seconds, hold at the bottom of your breath for 4 to 5 seconds. And then on the exhale, you want it to be 6 to 7 seconds because our vagus nerve is in charge of that longer exhale. And that increases something called acetylcholine. And that's going to help rest us or put us into our rest and digest side. And you want to do at least 10 of those breaths without feeling like dizzy or faint or anything like that. And if breathing, like some people can't utilize that, that's not like something that changes them, their physiology fast enough. I mean, I'm holding a toothpick right now. Can you see? So this toothpick, you can tap your ear with it. Okay. And it hurts a bit. And it's a good way to like get your mind off whatever's stirring up. And your vagus nerve is most superficial right there. So you can tap it. And that's one of the acupuncture points because I do acupuncture. But one day I was feeling super anxious and I started tapping here and it brought this kind of calm over me. And then there's different spots that I teach, like over your clavicle. There's like one spot by your knee, but that is a really helpful one for people that like breathing's not enough because you kind of need to interrupt that kind of, either thought process that's going on, or if it's like some sort of spiral, like if you're feeling anxious, something like that. So some people find that one really helpful. Cold showers, or even just an ice pack over your neck, over your face can help calm down. That's a simple way. Hugging people that you love, like that, like anything that brings you joy is pretty much turning on your vagus nerve. there's certain essential oils that you can smell, like lavender, bergamot. There's certain supplements that you can take. We have like a little handout that you can find out which one of these simple ones work for you, gargling or gagging, because it's in charge of the back of your soft palate, humming, singing. So, I mean, and they don't all work for people as well as certain ones. So I love the toothpick one. That works for me. And then even using your eyes and your face. So your eyes, you can gaze as far over to the right and you hold it for 15 seconds, and then you can gaze to the left, and it pulls the same fascia where the vagus nerve comes off of our brainstem with the other cranial nerve that innervates our eyes. And that can kind of turn it on. And then, that helps relax people. Puffing out your cheeks, using your tongue, like sticking it out and pointing your tongue side to side. All of these little things can help like get your vagus nerve back to firing, let's say, if it's a little bit sleepy.
So I got to tell you, the very first thing you told us that we could do, the box breathing, that's how I get my heartbeat to go back to normal. Like I just started doing it on my own because I would hold my breath thinking holding my breath would do it. So and it worked. It takes me, it's not the first breath, but it definitely puts it back into, so now I know it's probably related to my vagus nerve. If I can help get it back to normal doing that.
Because sometimes we don't notice that we're shallow breathing, right? And and then your heart's like, hello, like I need more oxygen. And so it like, people, we have an innate intelligence, you're doing that because your body knows like it needs more oxygen. It needs something more. So, you create more space for your heart, and then it can calm down. So, definitely our bodies tell us if we listen. They know.
So when I read your bio and you talked about working with athletes, but if somebody is sitting at home, do you do online services?
Yeah, we do. We do a lot of virtual stuff. We drop ship test kits where people can do collections, urine, stool, go to your lab close by, get some blood work, and then virtually we go over it and kind of take all of your symptoms and tie it together with some clinical findings or some data, and get you on things to start to get to the root cause, to help eradicate things. Some things are lifestyle changes. Some things are supplements to like eradicate a bug. Some are, supplements that help turn on your vagus nerve. Like I myself use, GABA at times, or other supplements that really help. So yeah, just kind of finding those deficiencies and filling in a few gaps, and then eradicating those toxins from the body, those bugs. And then, we kind of coach you through it, because we know it's hard. And we know sometimes people give you a pile of supplements and then there's no real follow-up. So we're always available. Like everyone gets a health coach along with me. And then we're always kind of troubleshooting through what's going on, because it is such a process. And I've been through the process, and I've been like, oh, that one doesn't make me feel good, so I'm just not going to take it. Meanwhile, like it would have helped me. I just needed a few days to like push through. So, and sometimes we don't want you to push through. So there's a lot of like close communication that we do in order to, help people be successful, because, some people you see that, oh, I've been to every functional medicine doctor. And it's like, if you look at their protocols, it looks like it should have done something, but they weren't taught how to stay on it, finish it. Like, what's the next steps? So we're always trying to be like very, very just detailed for people, because a lot of people need that, especially when it's straightforward, but it's complex when it's your day-to-day and you're adding new things in, right? So there's some hand-holding, which I think helps a lot of people.
By the way, I think that's super important, because you do quit if you think I don't feel good. And for instance, when people do a cleanse or an elimination diet, a lot of things starts coming out of your body. You might get a rash, you might get sleepy. There's a reason for that. And you might get scared and stop doing it. But if you have somebody like one of your coaches or yourself that they can say, well, is this normal? Yes, it is. That's good. It's pushing it out of your body, right?
Yeah.
So I love that you guys do the hand holding. I think one of the things I think is the funniest is when someone starts feeling better, they stop the protocol.
I know.
That happens to my husband all the time. He's a veterinarian, and people will bring their dogs in with cardiac issues and like, I don't know what happened. He's like, well, is he taking his medicine? No, we stopped. He was feeling better. Yeah. So it happens all the time that you get on this great protocol, you feel better and you think, I'm good. It's fixed. There's a reason it's fixed and it's feeling good.
Yeah, that's interesting that your husband's a veterinarian, because I see like veterinarian medicine and like they do things that we don't do. Like they do like, let's make sure there's no worms in the dog. Like it's as if humans don't get parasites, like, and it's like one of the most common causes of, they have tied almost every disease to like a specific parasite, like different cancers. There's a book that's super interesting and kind of out there, but you get like kind of the gist. It's called A Cure for All Cancers. And they show like which parasite is responsible for and why for different cancers, like which toxin is it from that parasite. And, so I don't know, there's just like, I became just fascinated with parasites because that was the biggest game changer for me, was once I got rid of those larger visible parasites, which was some kind of creepy to see. That's when my health took the biggest change. And it was just such a, like, I can't believe that was inside of me, and no one's ever talked about it. And so that became like, I became very interested in parasites. So I learned a lot about them through the years.
Well, I'll tell you what, I pay attention to parasites because we travel a lot outside of the country. Mm-hmm. And when you're drinking a different water, you're eating different foods, you're in different water pools, mm-hmm. right? You're walking through a river you've never been through. Like your body, parasites are parasites. They grab on and they like start thriving inside your body. So I'm always trying to be aware and thinking, is what I'm feeling connected to something going on? Mm-hmm. And so I love that you're teaching all that. And I'll tell you why I think veterinarians are better. Because when the animals come in, they can't say my tummy hurts when I eat, I have a headache, or I'm super tired. I'm not usually tired. They literally have to start dissecting everything to figure out what the root cause is of the animal's behavior. So we go in and we say, I'm tired, I have a headache. And they hear symptoms and think solutions for the symptoms and don't go in looking for what's causing that. Mm-hmm. So I think that, I think that they have to do a little bit more research because the animal can't really talk to them.
That's very true.
Well, I want everyone to know how they can reach out to you and how they can learn more. I'm on your website right now, and I noticed that you have Tone Your Vagus Nerve in 10 steps, and you have a guide in there. So I'm going to link everyone to that because I think that would be an incredible information for you to go to her website and grab that. But where can they find you?
So our website is vagusclinic.com, and that's where they can find that toning page for the vagus nerve. On Instagram, Vagus Clinic on Instagram, and also at Dr.S.Canestraro, which I got to get a better handle that's easier to find, on Instagram as well. And I'd say those are the biggest two to find us.
Perfect. You guys, we're going to put everything in the show notes. So you're going to be able to click right to that and go visit her site, grab that Tone Your Vagus Nerve in 10 steps. And if you have any questions or you guys want to start reaching out to them and checking out maybe some of those symptoms you can't quite put your finger on, and a doctor hasn't been able to make go away, is most likely connected to something already going on in your body. So thank you so much for being here today. We really enjoyed this.
Thank you so much for having me. I enjoyed it as well.
Thanks for listening to the Oh My Health, There Is Hope podcast. Make sure to visit Jana's website, bestholisticlife.com, where you can subscribe to the show on iTunes, Google Play, or listen there, so you'll never miss an episode. While you're at it, if you found value in the show, we'd appreciate a rating on iTunes, or if you simply tell a friend about the show. That'll help too. Let's change the world together, one health expert at a time. Looking forward to seeing you next time.